Hi, Becky.
Hi.
Hi, everybody. Happy summer evening in July. This is Dr. Maria Sophocles, and you're watching an episode of Gynecology where we learn all about everything women's health. And this Thursday, we're doing a focus on pelvic floor health. What on earth does that even mean? Well, we'll talk about it in a second. We're not doing carpool karaoke, even though it looks like we might be doing carpool karaoke, and maybe we'll do that at the end. But I am broadcasting from a car because I'm up in Cambridge, Massachusetts, where I had a day full of lectures and meetings and cool stuff in this very, very beautiful and intellectually stimulating place. With me is Becky Keller, and she is someone I've known for many years, and I'm so excited that she's also now my new professional neighbor, because I've been dreaming of having her work near me for a long time. Why? Because what Becky does, and she'll tell you what she does, I'm going to keep it a secret and let her introduce herself, is so complementary to so many of the GYN problems that my patients come to get help with. They assume that I can help them with medication or with surgery or sometimes with both. Sometimes I can, sometimes I can't. But many of the times that patients come for different issues, they benefit from pelvic floor physical therapy. And Becky's going to tell you what that is and how we use it and whether or not you're doing it right. So without further ado, I'd love you to introduce yourself. Tell us a little bit about what you do and about what your specialty really is, so that women can understand. It's really a little bit of a mystery, so to many women. And you and I both wish it wasn't so. Right. So this is our chance to publicize a little bit and let women know what great help there is for them out there.
Yeah.
Take it away.
Thank you. Thank you so much for having me on. This is so fun, and I always absolutely love talking about what we're going to talk about today, and really what I do, and kind of what I've dedicated my career to doing, actually. So as Maria said, I am actually physical therapist. So I've been a PT for quite some time, like 22 years now. And right about, in 2009, I was kind of looking to do something different. Like, I was a orthopedic-based physical therapist, so saw people a lot for neck and back and all kinds of other things that you would go to physical therapy for in an outpatient setting. And I was always kind of like, part of it was curiosity, really. It was kind of like, hey, I feel like I don't really know what happens in the middle part of our body. Like, I don't really understand like the pelvic floor and what that really is about. And so between curiosity and a little bit of, kind of necessity and wanting to understand a little bit more about my own body, maybe before I was going to have a baby and what was going to happen after I had a baby. And then just things that kind of happened where I was working, I decided to take my first course in pelvic floor physical therapy. And so I went on this course, not quite knowing, but I'd heard some things about it. And, it's quite interesting. So basically, it's a specialization in physical therapy that focuses on the pelvic floor, the pelvis, function in many ways of the bladder, the bowels, as well as sexual function. So I went on this course, and I was like, basically a big part of what we do, because it's a specialization. We have training to learn how to evaluate, how to treat, and how to work on the pelvic floor. So we in many ways do an internal exam. We learned all of this. And so it was quite eye-opening for me back in, more than a decade ago. But I was like, wow, there is such a need for this. And so I just started to like, what more can I learn? And over the years, taking so many courses, and then wanting to build programs and make it accessible for people, especially here in the Princeton area where we are. And so I helped basically develop and build a hospital-based program that became very big in our area. And then I wanted to kind of do more, learn more. how else can I work with people, help with people? What other treatment aspects and treatment and movement therapies are there that I can tie into the world of pelvic health? And so that's where I now am a kind of a fairly new employee of Active Core. So right down the hall from Dr. Sophocles in her practice. So I work at Active Core with two other wonderful pelvic health physical therapists. And it's a brand new center for us, which is beautiful. But I'll tell you a little bit about pelvic physical therapy or pelvic health therapy. We call it sometimes pelvic health rehabilitation, because it can also be not only physical therapists that do that, but occupational therapists too as well that do this kind of therapy. And so basically we take our knowledge of the musculoskeletal system, the neuromuscular system, and essentially we're applying it to kind of that midsection of the body. And we're looking to see how the pelvic floor, so the musculature, and you know what, I'm always used to teaching, so I have an example here. So we're talking about, here's our pelvis, right? You can see the spine coming down on it. These are kind of that top part of the iliac crest. They kind of look like Mickey Mouse ears. Here's our hip socket. And then when we think about the pelvic floor, we kind of think about all this musculature running from pubic bone to tailbone, side to side, deeper layers. And here you can see the sacrum and the tailbone. So these muscles basically have such an influence from the spine. They have such an influence from the breathing aspect of our body. So our respiratory diaphragm, our rib cage, they have an influence from our hips, believe it or not. So as I showed you here, that hip socket right here, the inside wall of the pelvis here is actually, those are hip muscles. And so we have such an influence, and this plays such a role as a core stabilizer within our body. So it works in conjunction with the deep abdominals, the deep back, as I said, the respiratory diaphragm, to help function and support things like the bladder, the uterus, the rectum, and how the functioning of us being able to hold our urine in so that we don't leak unexpectedly, or we're able to poop properly, or we don't have pain when we have things like penetration, or maybe an OBGYN speculum exam, or when we have intercourse, or anything else that can kind of cause pain. So those are the things as pelvic health clinicians or pelvic health therapists that we do to address for people. We also think about, too, what we don't realize, especially with pain. So there's a whole world of pelvic pain. Maybe things that people have heard of like vulvodynia or vaginismus, or pain within the organs like the bladder, which is interstitial cystitis, and things like that, where our pelvic floor can be really affected by a lot of those things, right? And so we can help reduce some of that, and we can help eliminate pain and get people kind of being able to get back to life and pain-free function. And we realize there's a huge component with the psychosocial emotional component and how that influences our pelvic floor. So when we think, oh, sorry, go ahead.
No, go ahead. Keep going.
I was going to say, when we think about our pelvic floor, it's not just the pelvic floor, but it's really how it works within the whole system of our body. It's influenced by all the systems of our body and has such an influence on the function of very basic things that sometimes we take for granted, like being able to pee properly, or being able to poop properly, or being able to move in life and do the things that we want to do pain-free. So
right. That's fantastic overview. Thank you for explaining that. I want to go and look at some of the specific disease processes that you can treat, or that we can jointly help. Yeah. We see a lot of women for whom sex is painful, and they develop a sort of involuntary tightening of the muscles of the pelvis when they attempt to have a GYN exam or penetrative sex. We call this vaginismus. It's really not a very pretty word, but it's just the word we've been given. And it's very embarrassing to a lot of women. They feel broken. They feel like something's wrong with them. Certainly, in my exam, I can check and see, is something wrong? Do they have vaginal atrophy from lack of estrogen, or from chemotherapy, or I can explore psychologically. Was there a history of abuse or trauma, or were they a long-time horseback rider or a competitive bicyclist, and there's nerve damage? You know, I can look at all that, but I don't have the expertise or time that you do to work with them to help them. So can you walk me through a little bit of meeting a patient like that for the first time, and what can you offer them, and what can you do to help them?
Yeah, and that's great. And this is like a great topic because I think so it happens so often that, you know, again, there can be, as you said, some of those components that can cause this. And sometimes it's can be a one-time, things didn't feel right, something caused pain, and my body and brain went into this very protective response with it. So exactly. So a lot of what we can do, and what's great is you kind of said it there a little bit too, is that, you know, we have a lot of time to be able to help and focus on people. You know, where I am, we do a one-on-one session for nearly a full hour. So within that time, we get so much that can be accomplished. And we again think about the pelvic floor not only in isolation by itself here, but then also all these other additional factors. So we start to ask questions in day one, like, you know, what are some of the things that are going on? What are maybe some of the associated concerns or fears that people have? Knowing and just educating on even pain science and all of those things can be tremendously important for just helping people along the way with that. We look at the whole kind of body, everything from how we're posturing to how we're breathing to what's going on also in surrounding muscles. So this is something that's important too, that the abdominals can get real tense and tight and create sometimes this increased tightness or increased tension and tenderness in these areas. Our inner thigh muscles, our glute muscles, everything kind of all comes into play. So we assess and look at all of those things. And then we start to think about, well, what's going on with this musculature? And how is it responding to its breathing? So when we're breathing, what's happening with these muscles? And that's a great way to work to relax these muscles in many ways, very voluntarily through breath patterns or changes in breathing. How our body's managing pressure that's coming from above that can be influencing. You know, again, what are some of those associations with why do we think that people are, and the brain has developed these patterns? So in many ways, we try to, you know, give the brain and the body and change that learned response a little bit. And we can do that through things like external touch first. We can do that through things internal releases and then deeper into the muscles, especially if there's things that may be scar tissue or something like that, in which created increased tension, which created, you know, an overall tightness within the entire pelvic floor. We also can use things like dilators, which are kind of like, you know, I want to say devices, but, you know, external.
I call them little silicone tampons or little silicone penises.
Kind of, yeah.
Depending on what we're trying to overcome. But,
right.
But we use them for preteens and young women and older women who have never used a tampon.
Yeah.
We use them for women who were formerly having comfortable sex and now can't. And we use them for women who've never been able to have anything in the vagina.
Yeah.
And they're graduated in size.
Yep.
So, which you know.
Yep.
So dilators are super low tech, super effective, super safe, I think, at helping to have women learn to train their brain to accept a little bit of stretch of the vaginal opening.
Yeah, and there's lots of different ones out there. There are silicone ones, and those sometimes we prefer some of those. Sometimes there's a little bit harder plastic ones. There's ones with handles. There's ones that vibrate. There's ones also too that we have, which can be more of a what we call like a pelvic wand, which is actually smaller, and that can be great for giving a very specific stretch onto certain muscles. Those can heat, those can vibrate. So lots of fun things that have evolved in many ways over the years with those type of products. But those are some of the things that we can work to treat with it. And again, it's a very I always like to say it's a very kind of holistic approach with it. So we go beyond just the pelvic floor and also look at so many other of these influences within the body and how our body is even moving. So from a very functional standpoint, movement. And we do a lot of movement things at Active Core to be able to help with getting somebody to move in a more of a pain-free environment. So all those different things that we can address and look at when we're working with the patients.
So give me a little example. If someone's got pelvic pain, you'll look at her gait and how she's walking or how she's sitting, and then you'll help her make adjustments or recommend maybe certain cushions that she can sit on or things like that. Help me with that. If someone just comes, because we see many patients with endometriosis and other unclear sources of pelvic pain, vulvodynia, and some of these women truly cannot sit at work or sit at the dinner table. How do you help them with that?
Sure. I always say, hey, we're physical therapists, so function's our middle name, right? So we're always looking to kind of see what's going on. And sometimes it can be things that people wouldn't even realize or think of, like the position of the foot and how it affects the entire chain of the body, all the way up into the pelvis. Think about where your pelvis is located in your body, right? It's in that midsection. So it's this gateway between upper and lower. It has to be able to have a lot of forces translated through that area, right? There's fascial connections. So fascia is connective tissue. Myofascial is muscle connective tissue, and that runs in many ways all the way up and down our body, front, back, mid, sides, all this stuff. So all of that is can be affected significantly in the pelvic area and all that stuff. So we start to look at posture, how somebody may be sitting, and realizing that if they're spending all day on their computer and they're hanging out all like compressed down, that can have a huge influence on pelvic floor. And definitely different sides or parts of the pelvic floor too as well. So talk about that. Like we certainly look at walking, we will look at posture, we will strengthen within that if we need to as well, and strengthen within the body system and the what we call neuromuscular system of everything. We will even look functionally on how when someone sits on the toilet, and helping them with, are their mechanics appropriate for getting poop out? Or what are some things and strategies that we can do? So lots of ways to individualize treatments. That's what physical therapy and pelvic physical therapy or pelvic therapy is all about. So super important that people go. That's part of it, is thinking about, people might be listening to this and being like, I don't know, is this really going to help me? What's this about? And people are surprised. From the educational component to, maybe we can change different things that even make something 50% better. Think about even just being, maybe if your pain's, a 9 out of 10, and all of a sudden we can make it down to a 3 or 4 out of a 10. So many ways that we can do it. And I think what's important is we're part of the healthcare team, right? So it's not just one thing, one provider. There's so many options for people with different types of pelvic health challenges out there. So from medical approaches all the way to more conservative, what we do in physical therapy. So it takes a village sometimes to help people, right?
For sure. And I feel like it's a very unused and unknown source of improvement for women. I know in some countries it's paid for after childbirth. It's part of what's paid for after you have a baby. I believe it's in France. There is pelvic floor therapy is part of the postpartum rehabilitation. And at Princeton GYN, we don't do OB, so we don't see a lot of postpartum issues. But we certainly see women who down the line will come to see us 5 years after they've finished having children saying, I've actually not been able to hold my urine well for 5 years. Or I had this pain after my episiotomy, and I've just been busy with kids, and now I'm many years out, and I still have that pain. And it's not always something that I as a surgeon can cut out or refix. And it's not always something as a gynecologist that I can just prescribe medication to heal. And so I certainly hope other OBGYNs can use and appreciate pelvic floor PT. But I think from our standpoint, Becky, the important audience is really the women themselves, so they can advocate and they can go to their primary care or a subspecialist and say, I'm having this issue, and I'm wondering if maybe an evaluation with a pelvic floor physical therapist would be in order. I think if we accomplish nothing else tonight in this, it's to have someone go, yeah, I do have something, and I wasn't sure who to talk to, and I'm a little embarrassed to talk to that person, and I don't know, do I go to my husband's urologist? And at least they can feel like, they can find a pelvic floor physical therapist where they live. There is a national website, is there not, where people could put their zip code in and find a pelvic floor physical therapist?
Possibly, but I think we're going to put up probably on the banner or put up at some point some of the provider directories or resources that you could find a particular provider in your area potentially. And so I put a couple of those up. So we do have, I would say here in the US right now, we have two major institutes for learning for pelvic health. So what's interesting, so as I said, I went to PT school quite some time ago. Nobody knew it. Nobody did it. Nobody talked about pelvic health physical therapy at all. I think I got one lecture on incontinence for people in a nursing home, right? It was nothing to where we are now as far as awareness, advocacy, all of those, and education really. And so we had to learn, many of us had to learn through these institutes for learning. One's the American Physical Therapy Association, has an Academy of Pelvic Health. So that's the APTA. And then there's also Herman and Wallace, which they're part of what they're called the Pelvic Rehab Institute. So I remember a decade ago, there were just a few courses that we could take. And now, gosh, there is probably 40 to 50 courses in different specializations within pelvic health. So it's amazing how much we can grow and learn and how much has changed with research. And again, I've seen it's been amazing to see that change. And a decade ago, people were like, what the heck do you do? And I had never heard of this or knew about it. So we've come a long way, especially in our area, but there's still so much to go as far as advocacy, as far as things like, as you said, that fourth trimester. So after we have that baby, it's like you see your physician, you follow up at maybe 6 weeks and not again for another year later. Well, think how much your body has changed, what it has gone through. And then you sit and think about, well, these things are all happening to me. I don't have resources or don't know what to do. It must be normal that this is happening to me. And so we start to
I feel broken, but I'm ashamed to mention it. And at my doctor's visit, the doctor has a waiting room full of pregnant people, and I get 6 minutes, and I just got rushed in and out, or I don't feel right talking about it, or the doctor doesn't bring it up. I'm writing a book right now, and part of the writing has to do with the fact that their physicians bring their own awkwardness and embarrassment to an examination. And so they don't offer. They hope, they say, how you doing? You okay? Fine, everything good? And they hope you say everything's fine and you're gone, because there's certain things they're not comfortable talking about, either because of their own sociocultural baggage or because they didn't get good training. I trained at a really famous place, and we did not get good training in pelvic floor physical therapy. We, like you, it was very tiny little thing that we sort of went, okay, I hope I never need anyone with that because I don't really know what it is. And that was a mistake, and I hope programs are changing and including that in training more, so that physicians and nurse practitioners and nurse midwives and PAs will be comfortable and confident bringing it up and saying, I'm not sure I have any other tools to help you. I find a lot of clinicians are ashamed and afraid to say they don't know what else to do or they don't have an answer. And I think if we can promote a culture of transparency and empathy, then we can have more clinicians saying, I don't have anything else to offer you, but I'd like you to go meet with a pelvic floor physical therapist.
And it can be that simple, is just saying, this person might be able to help you, and know that this is here and we are here, and it's certainly within our wheelhouse as movement specialists, I guess, in a way, and all of those things. So if we've even got providers listening to this, I mean, or anyone listening to this, if you're leaking urine, if you feel like you are running to the bathroom quite frequently, if you feel like you are straining to get your urine out, if you feel like you have a heaviness dropping down, that's pelvic organ prolapse, or this feeling of something stuck there and it's not right. If you feel like you are straining with constipation or experiencing, anything like that, if you feel like you are losing stool, fecal incontinence,
Right.
if you are having pain with a speculum exam, or pain with intercourse, pain with using a tampon or avoiding using a tampon, pain with external touch, like when you wipe or wear tight clothing, pain in any way in which you are functioning, and pain around the back of you, the sacral area of you, the tailbone area of you, pain in the abdomen, and it's been cleared by physicians that we've checked organs, we've checked everything else, there's nothing going on, is this musculoskeletal. And if you don't, send to have a pelvic PT give you an examination to really be able to kind of say, yeah, this, let me help you. And there's things that we can do with this. And we're more than just Kegels, which everybody probably heard the word, right? Tightening that. I think it's probably one of the most, overprescribed physical aspect of the pelvic floor. Will just tighten and do your Kegels and you'll be fine. And we know that not everybody needs to do Kegels. Not everybody will benefit from doing Kegels. We know that a huge portion, almost 50% of people, by just being told how to do them, can get it wrong. So they might not even be doing it right. And so it's like a trampoline here. This whole system has to kind of work like that with even every breath we take. So if your trampoline's stuck up here and it's really tight, Kegels aren't going to help you. And Kegels aren't necessarily going to stop leaking urine, because you might be leaking urine because that trampoline system is too tight and can't manage pressure. So you see how important it is to get to the right provider that has experience with being able to do this, to kind of help out.
Yeah. And I think of it like a home, right? A home has electric and plumbing and air conditioning and bricks and mortar. And if you just do a Kegels, it's like you're saying, I'm going to paint my front door and get the front door beautifully smooth and it won't squeak, and then my house will be okay. There could be electric issues, plumbing issues, structural issues, and a pretty front door is not enough. And so when women say, I'm just doing Kegels, or my doctor just told me do them, I say, I think that's, you have to be careful about that. That's a contractor saying, paint the front door, the house will be fine. It's important that you get evaluated properly. And Becky, can people just come to you? Do they always need a referral from a clinician, or can you evaluate someone and you can say, I think you better see a urologist or a neurologist? Or
Yeah, we can, and not every state can do this. Not every pelvic PT or pelvic OT can do this. So it all depends on the state in which someone lives. But yeah, in New Jersey, we're a direct access state, so people can come right to us, and then we can just say, hey, I need a medical provider to look at you because maybe you need this A, B, and C with this, or we need to go to a different specialist. Absolutely. So that is somewhere where we can kind of even be that more of that first initial person. Or the primary care doctor can just be like, well, she checked off, that she's leaking urine and overactive bladder. Let's go ahead and send them to PT, pelvic PT. So just something simple like that. It doesn't necessarily have to be. And I know I don't know if we're short on time or what's going on with that, but
we are. But go ahead and give me something good that everyone
I'm going to give you something good because everybody loves to hear this. So I'm going to give you some bladder tips. Okay. So I'm going to give you like 5 bladder tips that I like to say for bladder fitness, right? So listen, we are always working on cardiovascular fitness. We're always working on getting our exercise and our steps in, right? Well, let's also think about how we can help our bladder and bladder fitness, because this is a big thing. Lots of people experience overactive bladder, which that feeling like gotta go all the time. as much as 60% or 50 to 60% of people can be experiencing urinary incontinence at some point in their life. That can be young all the way through the life spectrum to more geriatric. So yes, we know over the age of 65, about 50.2%, I think is what it is, of people will experience some kind of leaking within their life. So that involuntary leaking. So I think it's always good to have good bladder health. So here's some of my tips, and people don't even realize, right? So what we drink can have effect on our bladder, okay? Well, they're called bladder irritants. Often they're everything that we love in life, which is coffee, which is carbonation, so carbonated waters, alcohol, sometimes aspartame or artificial sweeteners, sometimes really acidic drinks or juices can be it, sometimes chocolate even, so some of the foods or spicy foods, sometimes they can be bladder irritants. So what means that to the bladder then is the bladder doesn't like it, wants to empty, so it sends strong signals for you to go. That increases frequency of you running to the bathroom all the time, and you can also then increase that incidence of leaking that urine too, especially if your system's not great with being able to hold back that urge from the bladder. So that's one of them, making sure that you think about those bladder irritants. If not eliminate them, maybe significantly reduce them, or be mindful of how they affect you, because everyone's a little different with the effects on all of those things. And one big bladder irritant that people think they don't realize is, well, if I don't drink water, I'm not going to pee, or I'm not going to leak. But what it actually does is it causes dehydration, which concentrates the urine, and that becomes a bladder irritant in itself. So making sure you're hydrating really well. And that can lead us to my next tip, which would be, if you are constipated, get that addressed. That's something that we help with in pelvic physical therapy. But what people don't realize, and I've seen, is think about this. Everything's tightly packed in there. So when we've got poop that's collecting a lot in that rectum, or even higher up into the sigmoid colon and the descending colon, it can put pressure on this whole system here. It could put pressure on your bladder, increasing urgency, increasing incontinence. I've seen people we've helped poop, their incontinence has gone away. Okay, so that was my other tip. Make sure you're real good. What was that?
Who knew?
Who knew, right? Okay. Here's another tip 3. Avoid just in case urination. So this is about giving positive feedback to your bladder, also knowing and training your bladder in a way. We don't think as adults, we did potty training when we were little. We never paid attention after that, right? But sometimes we don't realize is that we can train our bladder into making it almost appear that it's smaller, in the sense that the body gets used to, or the bladder gets used to, emptying at smaller intervals. So right. Not into this nice full position that it should be in, with nice, 1.5 to 2 cups of urine. We're constantly running to the bathroom for just in cases. Like, oh, bathroom's right over there. Let me go. I'm about to get in the car. Let me go. Oh, I'm in the shopping area, but I see a bathroom there, but I don't really need to go. Let me go. Exactly. So what happens is we train then our bladder to think this is what full capacity is. And then it starts sending these really strong urges throughout the day. And before you know it, you're going to the bathroom 15 times a day. So right. That's another thing. Avoid some of those just in case urinations. Okay.
So we can, just to interrupt 2 seconds, we can then, what we do is we train women to keep a little bladder diary, so they see, oh, wow, I actually pee every 90 minutes, and then we say, okay, we're going to aim for every 2 hours, and then we're going to aim for every 2.5. And so just to quickly let people know what you mean by that is you can teach yourself to go so frequently that there's like a positive feedback loop on yourself that I better go, but you can undo it by training to increase those intervals. Sorry, Becky.
No, that's okay. Yep. No, good clarity there. Yeah. And that's also people then understanding, well, what is even normal with how many times we should be going. But bladder does best when it's emptying and filling on a normal routine. Okay. Here's, let's go tip 4. I had to look at my notes here. So sit on the toilet, not hover. Okay. So make sure you sit your booty down on the toilet. Good, and relax. So we don't want to strain to empty our bladder. So what should happen?
Hovering strain, excuse me, but teach me. When people hover, are they're by definition straining because they're engaging thigh muscle, core, other stuff to keep them balanced?
What happened? Right. So what's a little bit more is when we're hovering like a squat, we're activating our pelvic floor. Okay. So we're actually activating our leg muscles to hold us there. Our pelvic floor then is tightening. Well, think about this as a gate. So when we urinate or poop, this area has to relax and open, essentially. Yeah. So what you're doing is you're telling the body, this has to stay tight, but the bladder is supposed to empty. Well, the bladder can't empty properly unless this relaxes. So they're almost in this reciprocal pattern. When one does, the other one does the opposite kind of a thing. And so what happens is when we hover, we're tensing the pelvic floor, the bladder can't quite empty. So then people end up feeling like they've got to push to get it out. So the goal is sit, relax. The bladder knows what it needs to do because it's a muscle and it's going to squeeze to empty. You should not have to strain. So if you're straining, that might be something, hey, let's get somebody to help us with that training again on what needs to happen, which muscles need to be working the right way. Tip five was going to be make sure you see a provider that can help you, like a pelvic health physical therapist and all that stuff. But I'll give you, let's see, what can I give you? Another one here. Take time to go to the bathroom to fully empty. I think so many times we are rushing in our life, and I'm like, I'm going to try to pee in 10 seconds. Because I got to go do something. No, let it go, let it relax. Sometimes we even tell people to do a little rock and roll, which means tilt their pelvis a little bit so that they can fully empty, especially if you've got any kind of positional issues going on. Or challenges. Exactly, with the bladder dropping down, like the prolapse and all that stuff. So take time, breathe, relax, take time. Men don't have a problem doing it on the toilet. For some reason, women do. We just can't take time. We're always constantly rushing. So all those things can help with just normal daily good health for the bladder.
That's fantastic. I somehow feel like you have another 2 hours of tips that you could just go. And I feel like our listeners could learn so much more, and that we really need to do another session where maybe we could even go into active core to see, kind of film you a little bit and see some of the exercises you do and some of the things you do. I think we could myth bust a little bit and help with some more frequently asked questions. This week we're a little limited on time, so we're going to wrap it up. But Becky Keller, I know we're going to come back and do this. Why don't we do it in active core a little bit if we could? And we could even get a patient, keep it G-rated, but, just to help walk through some of the issues. We've done some tonight, vaginismus for sure, pelvic pain, but I hope listeners know this is absolutely the tip of the iceberg, and that pelvic floor physical therapy is such a wonderful, wonderful adjunct to getting help from a gynecologist. And we are certainly grateful to have you and your team literally on our floor in our building. And we're doing a Women's Health Expo this fall. We want to make sure that pelvic floor physical therapy is part of what we educate the community about this fall for that. So stay tuned. We're going to actually take a little summer pause from gynecology, but we will be back in the middle of September. And I'm quite sure this fall, Becky, you and I are going to have to find time in our busy lives to do this again and to really kind of chunk through some specific scenarios. And maybe we'll bring the dilators. We'll have a dilator face-off. I'll show you my favorites. You can show me yours. Because women need to know about them, and we need to take the shame and stigma away from this. This is not anything to be ashamed of. This is advocating for good health, just like going to a cardiologist is advocating for good health. So I thank you so much for making time tonight for the women who are watching and who will watch this on YouTube tomorrow. And we'll do this again this fall, I promise. Okay?
Sounds great. Thank you for having me so much.
You're welcome. Good night. Have a great night, everybody.
Take care.